Hey there, it's Raj from 3CB Performance. Arsenal left back and Scottish international Kieran Tierney suffered a anterior right shoulder dislocation on December 9th versus West Ham and underwent surgery 7 days later on December 16th. In this video, I'll explain Tierney's shoulder injury, the surgical procedure, his return to play RTP rehab process and timeline, and risks moving forward. To understand the injury, we first have to understand a little anatomy. The shoulder joint, known as the glenohumeral joint, consists of the humerus, upper arm bone, with the ball-shaped humeral head sitting into the socket-like glenoid fossa, which is actually part of the scapula, or shoulder blade. Accordingly, it's called a ball and socket joint. The joint is extremely mobile and has the highest range of motion in the body, and therefore depends highly on surrounding anatomy to provide stability. To that point, the glenoid is surrounded by a thin, fibrocartilaginous ring called the labrum, which provides added stability and support to the joint. Further, there are multiple ligaments and muscles, namely the four rotator cuff muscles, that provide further stability to the joint. An anterior shoulder dislocation is when the humeral head, the ball, completely pops out of the socket in a forward direction. This usually happens when the arm is in an abducted and externally rotated position, aka a 90-90 position with the elbow up and arm overhead, and then forced posteriorly backwards, resulting in the humeral head popping out anteriorly. In football, this can happen due to a fall, and that seems to be the case with Tierney, as he landed awkwardly in the 26th minute and immediately grabbed at the right shoulder. He was placed into a makeshift sling while walking off the pitch, and then left the grounds to the hospital in an actual sling for a full assessment, with the medical staff particularly checking for any concomitant axillary nerve damage, which is involved in roughly 40% of anterior dislocations. We'll never know the specific procedure Kieran had, but we can utilize key indicators to come to a hypothesis. The fact that Arsenal's medical staff continued to assess Tierney for roughly a week prior to deciding on surgery likely means he didn't have what's known as a bony Bankart injury, where the dislocation chips off a piece of the glenoid, with surgery indicated immediately. Rather, he may have had damage to the labrum, termed a Bankart lesion, which is far more of a gray area in terms of whether the conservative route, physio, or invasive route, surgery to repair the labrum, is the first option. However, the research indicates that for high-demand athletes younger than 25 who suffer a first-time traumatic anterior shoulder dislocation with labrum damage confirmed by MRI, surgery is relatively indicated. The surgery is known as an arthroscopic Bankart repair, in which the surgeon uses tiny instruments to repair and re-anchor the affected piece of labrum. It's considered a relatively straightforward outpatient surgery, with patients going home a few hours after completion. Arsenal have announced a 3-month return timeline, and if Tierney did indeed have the arthroscopic Bankart repair, that timeline aligns with the recently introduced accelerated rehab protocols for Bankart repairs, which have shown an average 11-week RTP compared to the typical 16 to 20-week RTP. The accelerated program focuses on restoring shoulder range of motion quickly while minimizing muscular tightness from post-surgery immobilization and defensive mechanism muscle guarding, and then methodically building up strength in the surrounding, stabilizing shoulder and scapular muscles. The major risk for Tierney moving forward is another dislocation, as there's inherent increased risk for re-injury after suffering an initial dislocation. However, part of the rationale for surgery being indicated in a high-demand younger athlete is to reduce those recurrence risks by manually repairing damaged anatomy. Further, new accelerated rehab protocols are relatively uncharted waters, as the research on their effectiveness and impact on anterior dislocation recurrence rates, albeit promising thus far, are still in their infancy with small sample sizes. That being said, Tierney benefits tremendously from having an elite medical staff planning his return every step of the way with constant oversight, from rehab to gradually returning to the pitch to advanced strength and conditioning. Additionally, Kieran also benefits from playing in a non-overhead sport, which further reduces risk of re-injury. There's always the risk of falling onto the shoulder or having it tugged on, but that risk is far lower compared to overhead sports such as basketball or volleyball. That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis, and you can always find me on IG and Twitter at 3CB Performance. Make sure to sub to this channel for the latest updates and follow along on all social media. 3CB out.